Hi everyone, welcome to Get Well with Dr. Shel. I am Dr. Shelena Lalji, better known as Dr. Shel, and I know as a board-certified OBGYN and a functional medicine expert, your health is unique and deeply personal. It is a combination of genetics, lifestyle, and environment. Know this, no matter what your starting point is, you are never powerless over your health. Being on a health journey is a marathon, not a sprint. This podcast is about walking you through many different perspectives on health conditions, symptoms, and solutions that can help you get from fatigued to fabulous. My mission has always been to offer my patients and community the best of mental, physical, and spiritual wellness. You can learn more about me and my wellness center and schedule your telehealth appointment at drshel.com. We can support you no matter where you are in the world. This podcast is a powerful and simple way to carry the wisdom of thought leaders from around the world in your pocket and continue to develop your own healing journey every single day. So let the journey begin. Welcome, everybody. We are so thrilled that you're here from my Get Well with Dr. Shel podcast. I am super excited about today's guest, Dr. Rodger Murphree, and a chance to talk about fibromyalgia. In my 20 plus years of practice, I have literally seen hundreds of patients with fibro who have sometimes been to seriously dozens of doctors before they ended up in my practice. And I'm sure Dr. Murphree has had the same experience. These patients, unfortunately, often get told that it's all in your head. Now that is, if there's one thing that nobody wants to hear is what you're truly feeling in your body, and you know your body and you know you're feeling something, and somebody in a white coat says, "I'm sorry, Mrs. Smith, I can't find anything wrong with you, it's all in your head." So this is something that Dr. Murphree and I and functional medicine practitioners like us, we want to really put an end to this. By using a variety of very specific approaches to treatment, as well as symptomatology, we have reversed this successfully in my practice as well as his. Another huge hurdle is the symptom game, where you may have thought that you have chronic fatigue or chronic pain or even depression or anxiety or insomnia, but really it's fibro, and it's all of these symptoms coming together under one umbrella. So stay tuned for a very powerful conversation with me and a wonderful leader and author on defining, diagnosing, and reversing this very difficult health hurdle. So let me tell you a little bit about our fantastic guest today. Dr. Rodger Murphree is a board-certified chiropractic physician and a board-certified nutritional specialist. He is an internationally recognized fibromyalgia expert. His Murphree Method is a combination of functional and orthomolecular medicine, which has helped thousands of patients get healthy and feel great again. He's the author of 3 books for patients and doctors, including Treating and Beating Fibromyalgia and Chronic Fatigue Syndrome, Treating and Beating Anxiety and Depression with Orthomolecular Medicine, and Heart Disease, What Your Doctor Won't Tell You. Dr. Murphree is a frequent guest on local and national radio and television programs, including NBC, Fox, and ABC. He writes for several professional and public health related publications. His articles have appeared in the Washington Post, as well as peer-reviewed professional journals, including Townsend Letter for Doctors and Patients, Chiropractic Economics, Alternative Fibromyalgia News Magazine, and the list can go on and on. He maintains a very busy telephone practice, helping patients all over the world get healthy and feel good again. So welcome, Dr. Murphree.
Dr. Shel, thank you so much. What an enthusiastic welcome. I'm just excited to spend some time with you and your audience. This is going to be really a lot of fun.
Well, yeah, I'm really looking forward to it, and I really appreciate you taking the time to give all this wonderful information to our listeners. So I'll dive right into it because we have so much to talk about. Basic question, what is fibromyalgia? How do you describe it to your patients and your listeners?
Well, it's, great question. That's, definitely where we need to start, because there's so much misinformation about fibromyalgia, misunderstanding. There's a lot of doctors that don't believe that fibromyalgia exists still to this day. And those that do really don't know how to treat it other than to tell them just to learn to live with it. But fibromyalgia is a syndrome made up of a group of symptoms that people have in common: diffuse, achy, sometimes disabling pain, brain fog, poor sleep, irritable bowel, restless leg syndrome. And these common symptoms are given a name, fibromyalgia, and it primarily affects females between the age of 36 and 68. 98% of those who have it are females. It affects probably about 8% of the worldwide population, although I think that number is growing as more and more doctors are, and sometimes erroneously, giving that diagnosis. But also I think more and more doctors are becoming aware about fibromyalgia, even though they really don't understand what to do with it.
Yes. So, that's a great description. And I think it's important to understand that a lot of times we have to have this umbrella where patients may have perhaps 3 out of 5 of those symptoms or what have you, and they simply don't know what's wrong with them, but they know. And I always tell my patients, you know your body best, and you have to be your own advocate. So if they have some of these symptoms, this is something that they need to be thinking that they might have fibromyalgia. So how do you confirm the diagnosis? Say there's a patient that comes in, and you and I deal with this all the time. How do you actually confirm the diagnosis?
Well, typically by the time they find me, they've been to at least half a dozen doctors over a period of years.
Yeah.
Oftentimes they get on the medical merry-go-round. You're real familiar with that. Yeah. And they finally wind up, seeking out me because they realize that with fibromyalgia, they're going to have to find somebody that knows something about the illness. But typically it's a diagnosis of elimination. Yeah. So patients will get blood work done to rule out MS and lupus, autoimmune disease, other pain syndromes. And then once that all comes back normal, then they'll be told, well, we think you have fibromyalgia. So typically it's a process of elimination, and then they get the diagnosis.
It's more of a diagnosis of exclusion is what you and I would call it, where, and it is important, and I do want to make a point of this, it is important to rule those things out, right? Because those other issues, whether it's lupus or another autoimmune disease or a neurodegenerative disease like MS you mentioned, it's a lot like ALS, right? MS and ALS, very similar. And as you know, my husband has ALS, unfortunately, and he was diagnosed 3 years ago. And I do a lot of work with neurodegenerative diseases now and ALS patients. We have a foundation. And what we have found is sometimes it takes patients years to come to the diagnosis. Now, in the case of fibromyalgia, it's not something that's going to kill them, but in the case of something like ALS, the average life expectancy is 2 to 5 years. So they might be very close to losing the battle before they even get a diagnosis.
Yeah.
So I think the point to be made here is if you have these symptoms, listen to your body and find yourself a doctor who can listen to your symptoms and help you get through the process quicker by listening to your symptoms and not just looking at a piece of paper, right?
Absolutely, yeah.
Very, very important. Now you mentioned, and you and I see this very, very often, that it is mainly something that happens in women, over 90%. Why is it more common in women? And while we're talking about that, where is the connection between fibromyalgia and sex hormones? What is that connection?
We're looking for 20 years specializing in fibromyalgia, and obviously there's got to be a connection, right?
Yeah.
And obviously you would want to look at the female hormones, look at estrogen, progesterone in particular.
Yeah.
I think what it really comes down to, what I've seen, and this is, there's not a lot of science on this, but I really feel like for females, typically they're more vulnerable to becoming depleted in serotonin. And serotonin is a brain chemical. It's the happy hormone.
Yeah. Men
typically are more likely to get depleted in norepinephrine, which is another brain chemical, another antidepressant type hormone. But I think that's the distinction. When I'm working with anxiety and depression patients, what I found is that my men patients really are missing out on having enough norepinephrine, whereas the female patients have serotonin. And serotonin really is the key for fibromyalgia, because that's really what makes up the whole ball of wax for fibromyalgia, is that they're deficient in serotonin. Because
Right.
the higher your serotonin level, the higher your pain threshold. The higher your serotonin level, the happier you are, less anxious you are, more mental clarity you have, and less likely you are to have irritable bowel syndrome. I mean, you have, more serotonin receptors in your intestinal tract than you do in your brain.
Yeah.
Why you get, when you get nervous, you get butterflies in your stomach. So
Yeah.
definitely connection. And I think a lot of times what happens, Dr. Shel, is patients will go from doctor to doctor and doctor. And finally someone, out of just what else is left, they'll say, well, you've got diffuse achy pain, you're exhausted, you can't sleep, can't get a thought together, you have mental clarity issues, you must have fibromyalgia. Everything else, all your blood work and tests look normal. The individual, she is happy to finally get a diagnosis. But really, that's where the challenge begins, because once you get the rubber stamp that says fibromyalgia on your forehead, you're treated differently the rest of your life. And when that happens, doctors, when they interact with you, they're looking at a fibromyalgia patient. That's all they see. They see somebody that they really don't understand. And they've already, for the most part, come to the false conclusion that this patient's just going to have to learn to live with this condition.
Yeah. Yeah.
Sad, but true, right?
Very sad, but yes, very true. And, it becomes a personal struggle. And for me, it's been a personal passion and a personal mission fibromyalgia has, because one of my sisters has dealt with this for literally decades. Now, I'll tell you, it's been so interesting to go through this journey with her, because she started all of her symptoms before I went into functional medicine. So as you know, when you're in traditional medicine, what are you taught to do? Exactly what you're saying. You do these tests, you rule this out. We don't know what it is. It could be this. Oh, well. And then it's sort of, in traditional medicine, we used to call it a trash can diagnosis, right? Because we just, okay, well, let's just throw them in this trash can because we don't know what to do about it. And then when I entered functional medicine, it was super interesting, because that's when we started as a family and as sisters really looking into the more holistic approaches, which you and I will get to managing fibromyalgia. So can we completely say, oh, well, you're done, no more, it's like a constant manage. It's a constant daily, protocol, and you have to perform those mechanisms of self-care, the stretching and the yoga and the nutrition and the healthy eating and decreasing inflammation and meditation. So I don't want to take away our punchlines there, but it's really important. And it's been incredible. I mean, her personal journey has been incredible, where she just is a totally different person. And it's so amazing to see that in a personal level, and then also in my patients. So I think it's just wonderful when, and you always say things, God blesses you with things in yourself and your family for a mission. Like he just hands you these missions. What was your impetus to get into fibromyalgia? So for me, I treat tons of patients with fibromyalgia now, and I just mentioned to you why it's been such an important thing for me. How about you? What made you get into fibromyalgia?
Well, it's interesting because, really, I would never have chosen to become a fibromyalgist. And I say that with all love, a lot of love and compassion. But
sure,
doctors, if they're being honest, they would say, this is a condition that is really incredibly difficult to treat and to understand. And the patients can be a little bit demanding, as you know, which they have a right to be. It's, first time somebody ever really listens to them. Mm-hmm. But 20 years ago, I was doing functional medicine, and I had a patient that was referred to me that had fibromyalgia, and 20 years ago, really didn't know much about it.
Sure.
I didn't even know how to pronounce it back then.
Yeah.
I was really having some success with some kind of medical misfit patients here in Birmingham, Alabama. And I had a relationship with the University of Alabama, Birmingham Hospital. I did research work for the neurosurgery department for a number of years. And it just got out that if you had a patient that couldn't do anything with, or was really interested in something, an alternative to just traditional medicine, send Rodger and just see what happens. So I got this fibromyalgia patient, and Dr. Shel, she came in and she had 30 different symptoms. Now, my first reaction, real candidly, was, this is a hypochondriac. Well, but I listened to her story. This is a woman who's 36 years old, has 3 kids, a great marriage. Her husband's very successful, well-known in the community here in Birmingham, Alabama. Something just didn't add up. And I realized, you know what, I'm going to have to do everything I can to help this woman. I just started using some nutritional therapy and did some testing, found out some things about her. And she got well, or went into remission in about 3 months. And I thought, well, if that's all fibromyalgia is, okay.
I can do this. Yeah.
And that's what happened. I started getting all these referrals because at that time, in the rheumatology department at University of Alabama, Birmingham, they had amitriptyline, they had muscle relaxers, I think Flexeril, and non-steroidal anti-inflammatories, and that's all they had for them. And they knew even then that was not going to work. They just gave them the medication, said, come back in 6 months. We really don't know much about this. Good luck. We're here to help you if we can. When I helped Sheila and the word got out, I got flooded with patients, and I had a choice. I could either just say, hey, this is above my call of duty here. These are too complicated. These cases are just too much. Or I can really try to figure out what's going on with these folks and try them. And that's what I did. That's where my path turned. I went from a very busy chiropractic functional medicine practice to where I was seeing at one point was just hands-on chiropractic, 100 patients a day. Then when I did functional medicine, I'd have 2 days a week where I just did that. And but then it went to, as I started getting more of these medical misfits and fibromyalgia patients, it went to like 20 a day. And when my book came out in 2003, I got asked to speak throughout North America, and I traveled, and it just, from there, it just took off. And now my practice is phone consults with, I get so fortunate. I get to meet people from all over the world by phone and work with them with their fibromyalgia.
All right. So just kind of piggybacking on what you said earlier, you and I both know that research has found that people with fibromyalgia have abnormally low levels of the hormones or neurotransmitters, serotonin, noradrenaline, dopamine, all of those in their brains. And low levels of these hormones may be a key factor in the cause of fibromyalgia, perhaps, as they're important in regulating things like mood and other such things. What are your thoughts with 20 plus years of work in fibromyalgia? And patients will always ask us this, right? I'm sure they ask you and they ask me all the time, Doc, what caused this in me? What do you tell them?
Yeah. Well, I think stress is the catalyst for the disease. And probably for, if we really want to be honest, we'd probably say that 95% of all the diseases out there are probably triggered by some type of chronic stress or acute stress. But in fibromyalgia, without a doubt, is stress. And we look at the individuals that have fibromyalgia, the majority of them came from a stressful household. And been verbal abuse. It could have been just a toxic environment, or they could have been that they were just not healthy as a child. Maybe they had some type of illness, Epstein-Barr virus, or that really was traumatic as a child. Lose that plasticity. And so when they go off to school, or they get married, or they get their first job, or they get in a toxic environment, whether that's a marriage or a work environment, whatever it is, or surgery, something is the straw that breaks the camel's back. And then the symptoms of fibromyalgia start. And part of that is the research shows us is that the hypothalamus, pituitary, the adrenals, as you just mentioned so astutely about the different hormones. But when that hypothalamus gland is not able to regulate the other systems in the body, then you start getting so many different symptoms
Yeah.
because these systems can't be coordinated and adjusted like they're supposed to. So individuals with fibromyalgia have problems with digestion and elimination. They have problems with their circadian rhythm, their sleep-wake cycle. They have a low pain threshold, a thing called allodynia, as you know.
Yeah.
And I think I use this analogy that we're all born with a stress coping savings account.
Yes.
And in the stress coping savings account, we have certain chemicals and hormones that we need to allow us to deal with stress. And all day long, we're all under stress, especially right now. But when we get under stress, we just make withdrawals from our stress coping savings account.
Yeah.
Helps us to deal with stress. So we use serotonin and dopamine and DHEA and cortisol, and we have these chemicals when we need them. But with the fibromyalgia individual, they have made more withdrawals
than deposits.
And they bankrupt that account. And the slippery slope, Dr. Shel, starts when they start to struggle with their sleep. That's what gets them. They may start off with diffuse achy pain because they're run down and fatigued. But once their sleep becomes compromised and they're not getting consistent delta wave sleep, deep sleep, that's when we see the symptoms of fibro start to show up, because you make deposits into your stress coping savings account by going into deep sleep each night. That's when you're filling up your account with serotonin and dopamine and human growth hormone and all these chemicals that the body needs to repair itself. But if you're not sleeping, and as you know, with your fibro patients, that's something that they're really challenged with. They become depleted, and then stress becomes more magnified. Now things that didn't used to bother them, bright lights, change the weather, that can send them into a flare. Whereas you and I, it's just, no big deal.
Yeah. It's very interesting. And I'm so glad you did a fantastic job explaining that, because to me, where I love to start is I always look at their adrenal hormones. So always do a salivary cortisol level to check what their circadian rhythm is like. And I oftentimes and almost always find adrenal disruption, whether it's, absolute adrenal exhaustion or adrenal fatigue. And just for the audience, we want to kind of describe, the adrenal gland is the gland that sits on top of our kidneys, and it releases the hormone called cortisol that Dr. Murphree was talking about. And that cortisol hormone is responsible for our stress. And when we're in a constant sympathetic state of fight or flight, because of different kinds of trauma, different kinds of stressors that you might have currently or past that you're dealing with, you are not able to have enough gas to actually make it to where you need to go. So you've depleted your tank and you really just don't have any repletion. So definitely look at the adrenal hormones. And then, of course, like you mentioned, sleep. Sleep is when you heal. You don't sleep, you don't heal. And that's just the easiest way. I mention it to my patients and I explain it to my patients is, if you're not sleeping, nothing in your body is regenerating or healing. And if you had to compromise, and they'll ask me, well, I don't have enough time to sleep because I got to do this, I got to do that, I got to do that. And I said, well, you've got to work backwards. You're blocking 8 hours no matter what. And then everything else has to fit into life. Because if you don't block that 8 hours, all of the rest of 16 hours is going to be strictly unproductive or inefficient, because you'll just be hurting and not feeling well during that entire time. So adrenal hormones, incredibly important. Neurotransmitters, incredibly important. My background being an OB-GYN, one of the biggest things that I do in my practice is hormone balancing with bioidentical hormones. And I truly find, and there's so many studies also done, right? In fact, I think one was done from University of Alabama that you mentioned, where they actually looked at fibromyalgia patients for an entire cycle and had them do a log of their symptoms and drew their blood every single day to measure their hormones, and saw that there was definitely a correlation, because we do see that when you have periods in a woman's life of hormonal fluctuations, whether it's postpartum, whether it's menopause, whether it's during pregnancy, whether it's during different cycles of their menstruation, there are some ebbs and flows there. So let's maybe talk about Because in my practice, I think supplementing and balancing their hormones using either nutrients or bioidentical hormones has really been a big part of getting these patients back to feeling great again. What's been your experience with hormones?
Well, I think for me, it's a little bit different. I kind of find that that's a piece of the puzzle that has to be addressed at some point. But I find that that's typically a little bit more downstream. I
Mm-hmm.
find that for my patients, if I can get them going into deep restorative sleep, that's number one. I feel like if you
Absolutely. Yeah.
you're not going to have any chance of helping them. And a big part of that is getting their serotonin level up. I
Mm-hmm.
like to use 5-HTP and the cofactors, B vitamins, magnesium, vitamin C, rather than an antidepressant. But deep restorative sleep, and you're so right. Then the second thing is they've depleted their stress coping glands, as you mentioned, the adrenal glands. So their get up and go has got up and went, right?
Mhm. Yes.
And what happens is now, because they don't have that cortisol and they don't have the other chemicals they need to deal with stress, as I mentioned earlier, stress becomes more magnified.
Yeah.
And then this vicious cycle, because any kind of stress can send them into a fibro flare.
Yeah.
And then I feel like after that, or along with that, I think what I've found over the years that you just have to saturate their cells with high doses, but the right doses and combinations of vitamins, minerals, excuse me, vitamins, minerals, amino acids, and essential fatty acids, which are the building blocks of the hormones that you're talking about. If
Yeah.
you do that, they're not going to see the positive results. It's you can't do it with a Centrum Silver or one a day. I mean,
Sure, sure. Absolutely.
that's the RDA, recommended
Yeah.
allowance,
Yeah. Yeah.
enough to keep you from getting scurvy or beriberi. So it has to be these high,
Absolutely. Yeah.
and then certainly not last, but the fourth part of the Murphree method then is to make sure we're fixing anything that's not working correctly in their digestion or their
Yeah.
elimination.
Correct.
Them have IBS, irritable bowel syndrome, but they also a lot of times will have leaky gut and
Yeah.
reflux,
Yeah.
SIBO, and these other things that have to be addressed. But
Right.
I find, Dr. Shell, if I can get those four kind of pillars,
Yeah.
get them up and get them
Yeah.
supported,
100%.
be other stuff that's going to have to be dealt with, no doubt about it. Thyroid, bioidentical hormone replacement therapy,
Right.
could food allergies, there's different things in there. But those four pillars at
Yeah.
least pick them up. And
Yeah.
now they're actually feeling good for the first time in a long time.
Yes. It's amazing to me, and I'm glad that you brought that up. Nothing, and I truly believe this, nobody that we treat, including ourselves, if so, again, going back over the foundation, I call it sort of the foundation of health,
Mhm.
is your sleep, your stress management, your gut function, and your nutritional correcting and replenishing your nutritional imbalance, right? Because all inflammation begins in the gut, we know that. And so when inflammation begins in the gut, it's going to go all over the body. And so with a fibro patient, when you touch them, it's really like you've just released this pain mechanism. And that's a lot of inflammation. The other interesting thing that, I always think about, and I find this fascinating, and I've sort of come to believe this more and more ever since my husband got diagnosed with ALS, is when I look at patients with chronic conditions, right? Whether it be MS, ALS, fibromyalgia, Crohn's disease, it could be autoimmune diseases, what have you. A lot of times I find patients who have emotional triggers, right? And emotional traumas, like you mentioned earlier, maybe a traumatic childhood, but something that has not been dealt with, right? And it almost feels like you take that emotional trauma and you're putting it in different parts of your body. So if somebody comes in with pain and it's always their leg, it's always their right leg or right hip or this joint, it almost seems like you need to release that trauma
Mhm.
from your body because it has a physical manifestation almost.
Mhm.
And I find that super interesting because, when we were trained as traditional doctors, it was always, physical things that are going on. Here are your lab tests, and there's not really this mind, body, spirit connection. And now I treat no patients without making sure that meditation, mindfulness, sleep, stress management, and those kinds of things are just a foundational part of treating patients. And just doing that is so satisfying and gratifying, because just like you said, in 2 weeks, they'll just notice this great difference because they've now started healing their body and enabling their body to heal themselves, right? Which is amazing. So the Murphree Method, I think, is just super. It's fantastic. Let's talk a little bit about, the patients that go to traditional doctors and they are given the diagnosis of, okay, fine, we've ruled out everything else, you have fibromyalgia, and then here's a prescription for Lyrica, gabapentin, antidepressants, what have you. Let's talk about that. Let's talk about what are those medications doing and why are doctors using those so much, and what are some of the downsides of using those medications long term?
Yeah, that's a great conversation, definitely to start. And a frustrating one too, because I think the thing that is such a challenge for the doctor who encounters somebody with fibromyalgia is they've got 12, 13, 15, 20 different symptoms.
Right.
Conventional medical world, it's about, and there's a place for this. I'm not anti-drug. I'm anti too many drugs, drug only, and the wrong drug. But in this, there's certainly a place. But when someone's got 12 different symptoms, before you know it, if you're treating the symptoms only, they're going to, a drug to put them asleep, a drug to wake them up, a drug to speed them up, a drug to slow them down. Before you know it, they're on half a dozen to a dozen drugs. And each drug has a potential side effect. Mm-hmm. Unfortunately, for fibromyalgia, doctors have learned that the medications are a dead end, at least long term. They can be helpful short term sometimes, but long term, they really don't change the quality of life in a positive direction for these individuals. And surveys have shown this. So those in traditional medical practices, they get frustrated because they're doing what they know to do, which is to try to help somebody with the prescription medication, but it doesn't work. So they give up on the patient. They blame the patient, right? But if you look at the go-to medications for fibromyalgia, the Lyrica, Grillis, Neurontin, gabapentin, pregabalin, these medications, and you look at the potential side effects of these medications, ironically, is number one is diffuse achy muscle pain, nerve pain, even though it's supposed to block nerve pain, confusion, incoordination, balance issues, poor sleep, anxiety, depression, weight gain, increased risk of type 2 diabetes, macular degeneration, and other issues. You look at those potential side effects and you think, oh my goodness, which is worse? Fibromyalgia or some of these side effects, and then the antidepressants. There's definitely a place for antidepressants, no doubt. There's definitely a place, but if you look at the studies, 70% of the time, a sugar pill, a placebo, is as effective as an SSRI or an SSNRI, selective serotonin reuptake inhibitor, and this is the best we've got for fibromyalgia. It's not, it's not a good fit. It's just traditional medicine, and a chronic condition like fibro is just not a good fit. The only way that you can feel good again with fibromyalgia, and you can feel good, but you got to get healthy. Yes. And I know that sounds so simplistic when people hear that who have fibromyalgia, but it's the only way, and it's different things to different people, right? I mean, as you've already mentioned, there's underlying issues. Fibromyalgia is just a name. That's all it is. It's a name given to these group of common symptoms. Yeah. But it doesn't cause the pain. It doesn't cause the low energy. It doesn't cause the brain fog. There's underlying reasons for these symptoms, and the goal for us as functional medicine practitioners is to find and fix the underlying. We've already mentioned some of those, right? Poor sleep, adrenal fatigue, poor diet. These are the causes of the symptoms.
Yes, and stress, of course.
Stress, absolutely. Yeah.
Yeah. So, well, I mean, that was great. I think, and it is frustrating because, in traditional medicine, we also sometimes, joke, but it's true. Sometimes we're treating the doctor, right? Because, you have a patient come in and you just have no idea what to do and you desperately want to help them. I mean, all of us, we've taken our Hippocratic oath and we want to do the best for our patients. Traditional doctors, functional medicine doctors, it does not matter. We all want to help our patients. And if you don't know what to do, then you prescribe the medications because, hey, I got to do something. I got to give them something. In patients where they have the trouble sleeping, and sleep is a very, very tough thing. It's very easy for us to just say, hey, you know what? You need to get 8 hours of sleep. So make sure you get 8 hours of sleep. Well, patients with fibro and many other chronic conditions just can't. They can't either turn it off, they can't fall asleep, or they can't stay asleep. What do you, and of course, then, you can talk about stress relief, take a hot bath, make sure you turn off the electronics, meditation, mindfulness, deep breathing, da, 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 da. We all know that. I think that's very important. What if that's not working? What do you do? What do you recommend to your patients?
Hey, I'm so glad you gave me the opportunity to share this, because I think this, if nothing else, if you get this, you're so far ahead of everybody else with fibromyalgia. And really, if you have a chronic illness, doesn't matter what it is, if you're struggling with your sleep, your health is going to be struggling. And those with fibromyalgia are tough insomniacs, so as you mentioned. And it's ironic that as a past insomniac that now I've turned into a sleep specialist because I've had to. But my sleep protocol is based on raising that serotonin level. Mm-hmm. So for my patients that are struggling with fibromyalgia, whether they're on prescription sleep medications or not, I start them off with 5-hydroxytryptophan, which is an over-the-counter amino acid. You can get this anywhere. But 5-HTP combined with B vitamins, mm-hmm. D and magnesium, that combination makes serotonin. And the other thing about 5-HTP is that it increases your natural sleep hormone, melatonin, by 200%. So what I have my fibro patients do is to start off with 100 milligrams of 5-HTP 30 minutes before bed with just a little bit of grape juice. It doesn't take much. That's just so the sugar will cause the body to release insulin, help to get the serotonin past the blood-brain barrier instead of going into the gut. And one of 3 things happens when they take the 5-HTP at bedtime. Number 1, they fall asleep and they sleep through the night. And that's what we're after. Number 2 is it doesn't do anything. So they're encouraged to go to 200 milligrams the next night. And if they need to, go to 300 the next night. If they're still struggling, then I would add melatonin, preferably sublingual melatonin that dissolves underneath the tongue. And they can go up to 12 milligrams. They can go higher. Yeah. They're working with somebody like yourself or somebody who's trained in functional medicine, they can go higher. But melatonin, it can be very helpful. Then there's other things like GABA and L-theanine, mm-hmm. things that are out there that can be helpful. Now, there are a few people, and those that are watching this, you know who you are. You're the weirdos who, and I say that affectionately, but you take GP, and instead of putting you asleep, it makes you more alert. Yeah. And that can happen to about 1% of people who do this. If that happens, then I recommend my patients take the 5-HTP during the day with food, mm-hmm. and then that's not going to make them sleepy, but it's still going to build up. But most importantly, the reason why I start with 5-HTP instead of melatonin is because as we raise that serotonin level, the pain threshold goes up, so pain goes down. Now, it doesn't matter where your pain's coming from, whether it's nerve pain, whether it's trauma, scar tissue, or it's from osteoarthritis or osteoporosis. It doesn't matter. Once you raise that pain threshold, your pain goes down. So 5-HTP, making that serotonin, we know will raise the pain threshold. Then we also see as you raise that serotonin level, you're less anxious. Yes. You're the happy hormone. You're less likely to have irritable bowel syndrome, and you have more mental clarity. So that first protocol to me is the linchpin of everything else I do.
Absolutely. I think, you just hit it on the bullseye. 5-HTP is also great for depression. Yeah. And it serves as a natural antidepressant. And so the combination, and I think it's great to work with a functional medicine doctor to be able to say, okay, start with this, let's follow through. because my favorite, and this is just everybody has their favorites, but my favorite combination, there's a combination of liposomal liposomal because it's, it absorbs so very well, liposomal GABA and L-theanine that I give to my patients, and also liposomal melatonin. So sublingual liposomal, I think you can't just run to the drugstore and pick up the first thing you buy and, you can find, because you and I both know that over-the-counter supplements are so very different than supplements that are more medical grade and more refined and don't have the fillers and definitely have the absorbability. So I'm glad that you're bringing these things up, because you can't just you don't want to just take 5-HTP and expect it to work. Like you said, you want to get a 5-HTP that is combined with your B6 and your magnesium so that it can do what it needs to do with all of the things working together. So that was a wonderful overview on what to do with sleep, because I always think that it's a great idea to start with all the natural things that you can do to rebalance what actually went wrong in the first place and get to the root cause, rather than slap a Band-Aid with a sleeping pill, or slap a Band-Aid with an antidepressant or an anti-anxiety pill or an anti-whatever pill. Now, like you said, I too believe that there is a place for medications if and when you are unable to control it more naturally. So with that being said, this is a complex but very, very important discussion. Fibromyalgia is a very complex condition, but yet it is a very gratifying condition to treat for us, because these are patients that are truly desperate and have these symptoms that they cannot get an answer to. And for this, you have come up with this amazing Fibromyalgia Summit that I'm so excited about. So talk to us about the summit and what is happening. When is it starting? I know it's starting very soon, like next week almost. And what encouraged you and motivated you to take on such a big project? Because this is a really great give back to everybody out there, really.
Well, thanks so much for bringing that up. Yeah, it's been 9 months of love, labor of love, and but I've enjoyed. I've got to meet so many wonderful people, so many practitioners that I probably wouldn't have had a chance to meet. But I've gathered over 24 of the leading functional medicine health experts from around the world, and they all share a little bit about their protocols that would be helpful for fibromyalgia. I really believe right now there's just so much doom and gloom in the fibromyalgia community, really over the last half decade or so, maybe even longer. When I first started treating fibromyalgia, we were thinking, well, we'll come up with a drug cocktail, which I was fine with that. And of course, I realized it was going to be a combination of probably some prescription medications and some naturals. At one time, I had a very large integrated medical practice where I had 5 medical doctors who I worked with, and we combined prescription and naturals. And I learned the hard way that really the thing that worked best for them was just going natural. But the summit was my attempt to really get the message out there that it's not about learning to live with fibromyalgia. I don't believe anybody deserves to live in chronic pain, no energy, brain fog. You don't know from one day to the next, is this going to be a good day, a bad day? You give up your friendships, you give up your hobbies, you probably give up your work, sometimes your marriage. I really feel we've got to get the message out there that you can feel good again. If you take the right steps, you can, and if you're willing to be proactive, there are proven methods out there that can help you start to treat and fix the underlying causes of these symptoms. So the Fibro Summit, the Fibro Summit is my gift back to the fibromyalgia community. It's, my mission for the last 2 decades has been to help those with fibromyalgia learn how to live healthier, happier, more enjoyable lives. And this is a tool, I think, that can hopefully have a big enough reach that can really help a lot of people get on the right track to get their life back.
That's awesome. Well, I'm so glad that you're doing this, and we will definitely support you in any way that we can. We are going to send out the link to your summit, as well as some more information about your website and your books, because the work that you're doing is just phenomenal. And, from somebody who has treated hundreds of fibro patients and has a family member with fibro, I thank you for doing all the work that you've done over the last couple of decades. And it's been such a great honor to have you as part of our podcast. Thank you for taking the time to talk to our community and our listeners. You've been fantastic.
Well, thank you, Dr. Shel. You're a delight. So I really appreciate the opportunity to get to know you a little better. And I'm just sure you're just held up as a breath of fresh air there in your community. We need more people like you. It's just, it's refreshing to see that we have doctors who still really care about what they do and care about making a difference in this world. So thank you for what you do.
Absolutely. It's an honor and privilege. And likewise, I think the admiration is mutual. So have an awesome day. And everybody, thanks for tuning in and thanks for listening. And tune in once again. We'll see everybody later. Thank you so much for making time for today's podcast with Get Well with Dr. Shel. I know that this conversation and education can help you to create your best life possible on every level. So definitely tune in to hear the newest expert and learn the latest protocols to support your best health journey. You can learn more about me and my wellness center at drshel.com, drshel.com, and I hope that you will make time to come visit us in the Houston area to take a deep dive on self-care. My team and I are completely devoted to helping you live a better life from this moment forward. The best days of your life are ahead of you, I promise. This podcast is a powerful and simple way to carry the wisdom of thought leaders from around the world in your pocket and continue to develop your own healing journey every single day. So let the journey begin.